to my brown physio. I'm Dr. Neha Singh, and today in this video we're gonna study about proximal humerus fracture, also it is known as humeral neck fracture. It is common in middle or elderly age patient. The mechanism of injury is fall on outstretched hand, road traffic accident, blow on lateral side of the arm during epileptic fit. Classification are anatomical neck, greater tuberosity, lesser tuberosity, shaft or surgical neck of humerus. Clinical feature: pain, swelling, loss of shoulder range of motion and function, hematoma, contusion, and bluish discoloration can be seen. For investigation, CT scan and X-ray is done. In case of rotator cuff injury, if it is present, then MRI is done and drop arm test positive can be seen. For treatment, if it is undisplaced fracture, then 80% of fracture are minimally displaced. Early mobilization to prevent joint stiffness is done. Pendulum exercise, pulley, elevation, internal and external rotation, and wall climbing is prescribed. For the displaced fracture, ORIF with buttress plate and screw or locked compression plates are used. A collar cuff triangular sling with chest strap is done. The complications are joint stiffness, malunion, AV and neck of humerus, non-union of surgical neck. Now let's see the physiotherapy management. The rehabilitation goals are to restore full range of motion of shoulder, to strengthen muscle of and around shoulder, to restore activity of daily living, then for pain management. Up to 2 weeks, gentle pendulum exercise, no straining of elbow or shoulder is done, no weight bearing, and for pain, cryotherapy or TENS is used. Between 2 to 4 weeks, pendulum exercise with sling, gentle passive assisted exercise, isometric shoulder exercise. On and off sling is worn, active range of motion of wrist, finger and forearm, no weight bearing. Between 4 to 6 weeks, pendulum exercise against gravity is done. Shoulder flexion and abduction only up to limit range. Elbow isometric and isotonic can start with the limited activity of daily living. Between 6 to 8 weeks, active and active resisted exercise should be done. Isometric exercise of shoulder, weight bearing as bearable. Between 8 to 12 weeks, by this time, fracture is well united. Active and passive range of motion is done. Progressive resisted exercise, strengthening and endurance exercise, full weight bearing and activity of daily living activities are done. In the case of surgical treatment, during first week, check is made for the wound, infection, stability of fixation and padding of the sling. End of second week, suture is removed, no active range of motion, only passive range of motion. By 6 to 8 weeks, active range of motion with terminal stretching. 8 to 12 weeks, resistive shoulder exercise is done.